All right, thank you, Taylor. And as we see a rise in coronavirus cases across the state, many are wondering if hospitals in Maryland are prepared for a rise in patients. So joining us this morning with more on that is the CEO of the Maryland Hospital Association, Bob Atlas. Good morning, Bob.
Good morning.
All right, so I need to ask you, we have seen 17 straight days with over 1,000 coronavirus cases, and hospitalizations continue to climb. How are hospitals doing right now in terms of capacity?
Well, definitely filling up. We have empty beds still in our hospitals. Some hospitals are pushing the limits, but nobody is bursting at the seams just yet.
Okay, so Bob, I want to read some of the numbers for you right here and for our viewers. If we could put up this graphic here so folks can get a look at this. We currently have 1,207 people hospitalized. Back on November 1st, there were only 523, a big difference there. That's up by 684 people. If things get worse, as you mentioned, what will we do with these patients? What would happen next?
Well, the first thing that is already happening is hospitals are working with each other to make sure that they can spread the load. So not every hospital is as full as every other hospital. And we're working actually with the state government to set up a kind of a clearinghouse so that hospitals can transfer patients as needed if they become overfilled.
And as winter approaches, what's the thought there?
Well, we're seeing the spike already with people moving indoors and having maybe more contact with one another than they should. And so that's expected to continue until, maybe the end of the year. So we are concerned. We want people to be really careful with gatherings, with indoor dining in restaurants, with make sure that you wear your mask no matter what when you're in contact with other people.
Wash those hands, of course. That's a message. Now, we certainly know a lot more about this virus than we did several months ago, and a lot more people are being tested. How is that playing a role for hospital personnel and capacity?
Well, there's no denying the strain on our frontline caregivers, but we do have a better grasp of how to handle this disease. So, for instance, one way of we're seeing that is back in May when we had our first peak, 1 out of every 3 patients in a hospital with COVID was in an intensive care, and now it's about just a little over 1 in 5. So we've got a different distribution of cases, and we're better able to handle it. And we have some new therapies that have been tried and seem to be working a little bit to help reduce the severity of the illness.
Good news there. And also good news, we have the news of the 2 coronavirus vaccines, Pfizer and Moderna. How are hospital personnel reacting to that?
Well, we're getting ready to receive those vaccines. The Pfizer vaccine, of course, was submitted for FDA approval yesterday. The Moderna one is a little bit behind. So we may see vaccines start to appear in Maryland hospitals for distribution, of course, primarily to healthcare workers first by mid-December. And that's a good thing, but we have to get an awful lot of people vaccinated before we can consider our whole community protected.
Anything else you'd like viewers to know?
Well, our hospitals are really trying hard to take care of everybody who needs their services, not just COVID patients, by the way. We have so many people with other ailments and injuries and needs, and we're serving all of those needs, and we don't want people to stay away from a hospital for any reason whatsoever.
Okay. Dr. Bob Atlas, he is the CEO of the Maryland Hospital Association. Thank you again for your time.
My pleasure.
All right, stay safe.